The following video is part of the Northern California Training Academy and Casey Family Program's Crisis Communication and Preparation video series. This series is designed to walk child welfare leaders through steps to take in order to be prepared before an incident occurs, including the development of a crisis communication plan, working within a political environment, and creating a narrative that promotes successful solutions that will improve the safety and well-being of children and families in care.
I am one of the vice presidents at Casey responsible for our work with state and local systems and policy, and have a background as a child welfare director and on a variety of commissions, and I'm going to talk about that. But one thing that it's very clear that I'm not is a communications expert. And my career has been in child welfare as an administrator, and before that as a psychologist. And so when I was asked to present here, and thought about really focusing on the work in Los Angeles as kind of the bulk of the presentation, I invited Louise Grasmer, who was the PIO in Los Angeles during the time that I was there, to really give a perspective of how a director and a PIO can work together to really try and further the agenda of the agency. And so we're going to kind of tag team this, but those of you who are PIOs will be able to hear her perspective of the work, and you'll be able to hear my perspective as a director. When I started in Los Angeles in 2003, there were more foster children in Los Angeles County than in all but two states, and those two states were California and New York. That politically, and all of you have boards of supervisors, Los Angeles at that time was unique in that the department directors, and specifically the Director of Children and Family Services, reported directly to the board. So there wasn't an umbrella human service agency, there wasn't a CEO, it was a direct report to the board. There's also in Los Angeles an intensity to the work because of the public interest and interest from a lot of very powerful people in the community. And in coming to Los Angeles, this is what I was greeted with. Welcome, now get busy. And it was one of those kind of Dorothy, you're not in Kansas anymore editorials that was certainly challenging in many ways, but in some ways too, what was interesting was the LA Times probably laid out a lot of things that actually needed to happen in Los Angeles. And so as we made progress, take a guess as to whether they ever came back and said, this is what we said you should do, this is what you've done, you got it right, and we're going to celebrate. How many times did that happen? Yeah, okay. So part of the history in Los Angeles, and some things, again, that you may not know, but I think it provides a foundation for the remainder of the conversation in thinking about crisis management. So I was the fifth director in 5 years, and if I'm not mistaken, every previous permanent director had either been fired or forced out. In 1998, 1 in 11 children in the United States in foster care was in Los Angeles County. And so, as you might imagine, there was a very high placement rate in Los Angeles, which kind of drove the placement rate for the state. But accompanying that was a very high abuse rate in foster care. And I believe the year before I started, there were 4 or 5 high-profile deaths of children in foster care, which prompted the ouster of the previous director. Too many children were in long-term foster care. When I started, 19,000 of the about 30,000 children in foster care were in, quote, long-term foster care, so little work being done to reunify them. There was a very, very powerful Children's Commission, and they took pride in the fact that they were responsible for the firing of every previous director. And they had been very powerful, very influential in the work that was being done. The department was, in my view, trying way too much. The department was very initiative happy. There were a number of initiatives that had been started because the commission wanted them, because the LA Times had a headline article that said this should be done, or because the board decided that they wanted something in their jurisdiction. Everyone, it seemed, was determining the direction of the department, but the department. The fact that the previous director had been ousted suggests that probably crises weren't being managed particularly well. We were doing, in my view, quite poorly on outcomes. There was political support probably for one of the first times in the history of the department. But the community support, and I think part of what was driving the crises and the negative articles was there was very little community support. Very few people were saying that they took pride in the work that Los Angeles County DCFS did. And I actually recall, it was one of my first few days on the job, and a reporter from NBC News came up to me and said, you know, your agency is more despised than the Los Angeles Police Department. And we could easily get a number of people out to protest in front of your office if we did some outreach. And I thought, wow, what a nice welcome. Thank you so much. But I think it was true at the time. And I think that it really led to the kind of crises that we ended up facing. So there were some clear things that we needed to do early on. And we started to kind of think about what our work should look like over the next couple of years. But probably the single most important thing that we did were we started talking about, you know, kind of what it would take to actually make sure that children were better off. And they said, you know, there are all these social workers who aren't doing social work functions, who've been pulled off the line to do all sorts of other kinds of things. And we're out there really struggling with high caseloads and very difficult families. Wouldn't it be smart to move some of those people who aren't carrying cases to actually carrying cases? And I thought, sounded really smart. Thought, sounded really easy to do. How foolish of me to think that it would make so much sense and be so easy to do. But we did it. We decided that we would target staff, and there were about 500 positions that had been pulled off the line to do any variety of functions that weren't case carrying, and we decided that we would be able to move all 500 of those staff back to case carrying work, to immediately bring down caseloads, because the message was we're going to focus on improving outcomes for children. And the only way to do that is to make sure that there's more, that social workers can spend more time with families and can improve their decision making. And so kind of saying all of this stuff but not doing something was going to be foolish. So we decided to take on a very challenging task and ended up moving about 200 to 250 staff, so didn't achieve the ultimate goal, but were able to move a lot. And I think it began to send a message about what the agency was going to be about. So that was really critical as a first step to do. But I think what's safe to say is that we didn't have a really clear direction. We were driven by the board, by the commission, and others. We didn't have a good story to tell. We were completely reactive in handling crises. We were still in the midst of crises. We were really seen as uncaring bureaucrats, and there were too many children in care. And so this is after I've been in the position for about 8 months. And these are articles during that time, some of the headlines during that time. Children endangered in wasteful, overburdened Los Angeles County system. The foster care mess, failing the children. Foster care system, one of the most dangerous in the nation. Foster care in crisis. And I would just add that there were probably another 15 or so headlines like this. And I mean, this is the second biggest media market in the country. It's Hollywood. I mean, there are all sorts of other things to cover. But the media was covering DCFS, and not very positively, as you can see. And so we really were in a position of crises during this time. And I'm going to come back and talk a little about what we did specifically and what happened over time. But I'm actually going to ask Louise to talk about, so you're a PIO in the middle of crises. You have 15 or 20 kind of negative headlines, people coming at you always. What do you do as a PIO?
Good afternoon. I just want to say that I totally sympathize with you. I've done your job. I know how hard it is, and I have a lot of respect for you guys. Like Dr. Sanders was saying, there were bets about how long he would last in the agency when he arrived in LA County. I felt like there were a lot of bets going around about how long I would last in the agency as well. Because I came from the outside, I was hired basically with Dr. Sanders. But I lasted almost about 7 years, which, as you may know in child welfare for a communications professional, is a pretty long time. So when I first arrived, what I had to first do is analyze the office and see what kind of communications effort was going on. And I really found that the communications effort was very not well organized. The press releases all looked different. There was no clear message coming out of the office. There was no brand to the agency. There was no brand to the office. Whoever happened to be there that day was taking the calls. There were no meetings going on to discuss how there was going to be a response to a call that came in. It was basically very siloed. So there were several people working in the office, and they were each handling calls on their own without talking to each other. So I knew that that was going to be something that I had to address first. But when Dr. Sanders arrived, he made it very clear that we needed to change the way of doing business at the department. And he set some very clear goals with the executive team, and it helped set the tone, actually, for our communications effort. But first, as you see in these headlines, what I needed to do first, probably the first 6 months to a year, was basically just get my team comfortable with handling crisis situations, which is very hard to do. In LA County, it was happening literally almost on a daily basis, and I'm not exaggerating. There would be some sort of call coming in that would rise to a low, medium, or high-level crisis situation. It could be something like a child death, or it could be something like Britney Spears driving with her child in a car, not strapped into a car seat. I mean, it was something like that. So we had to begin planning to respond to all different kinds of situations and all different kinds of reporters, from the local newspaper all the way up to the entertainment reporter for CNN calling us. So what we needed to do was establish a system of how we were going to take the calls, who was going to be the point person, a flow of information and a flow of communications. So we came up with, the flow of information from media staff and the public. And what we always began with was the information gathering and making sure that we knew everything about the case before we started talking. So that meant calling staff, calling any kind of managers that were in charge over that issue, talking to them, talking to social workers, and getting a clearer picture of what was going on. Once we'd gathered the information, we would, meet and talk through it and decide what the response was going to be, what we thought the best response would be. Then we would take it, or I would take it to Dr. Sanders, discuss it with him, we'd brainstorm ideas, and then we would make our response. So I'm just saying all this to illustrate that it's really important to have a really good open line of communication with your director, and also with your county council and all other higher-ups that are involved in your agency. I know that the PIOs in this room know this, but a lot of times what happens is somebody will call you, or a reporter will call you, and you have no idea what they're talking about. So they just hit you from out of the blue with, I've heard, this child was, died yesterday. And you're just like, what happened? Oh my goodness. That's not an ideal situation. That is far from ideal. But that's not a reason to panic either. There's nothing wrong with telling the reporter that you have to call them back, that you have to, get more information for them and you'll get back to them. We always tried to work with the reporters to give them a clear picture, working within confidentiality, to give them a clear picture of what was going on. This was very important. In some cases, situations, and I know Dr. Sanders will remember this, that we worked proactively with the family court to open case files, proactively open case files. Not waiting for the reporter to do it, but we would actually go to the court, open the case file so we could talk more freely about our role. And I have to tell you, probably in 90% of the time, this served us well. This was a very out-of-the-box way of thinking about this issue, especially in LA County. When people first found out, especially a lot of the county council, the board of supervisors, many of the managers found out that we were doing this, that we were taking this approach, it did not sit well at first. But as we started using this approach and we found that it started paying off, they started coming around on that issue a little bit. So I'm sure all of you are at different stages of planning your communications. I'm sure some of you PIOs in this room have very well-oiled machines. So you have your systems in place. But some of you might be at the beginning stages of thinking about what a communications plan looks like for your office. So I'm just going to give you some of the basic tips that I used when I was a PIO in LA County. The first one is just establishing an internal crisis communications team. So get your core group of people in place. So that obviously means your office, your people, and then it could mean the heads and managers of specific programs. So you can have that in place already. They know you're going to call, and they'll be ready to take your call. So you will not get that initial resistance when you're calling. Always try to think ahead. Try to think ahead of what are the issues that you think could rise to the level of a crisis in your agency within like the next 6 months to a year. Ask yourself too how your department's goals and missions can help diffuse these crises, and then get in front of the story and start pitching those stories. So then when the actual crisis hits, you have the background and the framework of that. I can give you an example for that. We launched a strategic decision-making tool, which was a child safety tool in Los Angeles County. When they first started talking about this tool, I was thinking to myself, this could be a landmine for bad stories. People are going to say that now we're robots, now we're not thinking for ourselves, we're just putting information into a computer, social workers aren't doing their jobs. I mean, all these scenarios of all these horrible press stories were coming into my head. So that was one thing that I started thinking about, what can we do to kind of diffuse this when it hits, because I know this is going to happen. So what we did is we actually invited the Los Angeles Times reporter, the beat reporter for our agency, in to my office. I dragged in, kicking and screaming, the IT professional who was over strategic decision making, who knew everything about the tool, who knew how it worked, and kind of dragged him in there with the reporter from the Times, and he basically walked this Times reporter through this very complicated tool. And it actually served us really well, because when the reporter had to reference this tool in future stories, he had a very clear background and understanding of how it worked. What we also did, what I did with Dr. Sanders, is we met with the LA Times editorial board pretty soon after he was hired. I think probably within the first 3 months even. So that's also a very useful tool. If you get in proactively and meet with whatever the largest paper is in your market, their editorial board, because what I found is a lot of the stories that are negative come out of the editorial board, and the reporters feed the editorial board stories. So if you get in and kind of explain to them what the mission and goals are of your department, that will also serve you well. And also have meetings and lunches and just get to know you meetings with reporters that you've never thought to reach out to. So for example, you can meet with an education beat reporter to discuss how you're improving educational opportunities for foster children. You can meet with columnists to discuss the challenges of children who are aging out of the system. Talk to political reporters about legislation that's going on. and what your agency is doing to be proactive about this legislation. Also, what I like to do was at least pitch one positive feature story a month. I kind of just set that as my own personal goal, to kind of pitch one positive feature story a month. And what I did was I just began knocking on doors. I began calling staff, just randomly calling staff, finding out what was going on in their offices. Los Angeles County is separated into, at that time it was 17 offices, well, 18 offices now, in a huge area. So what I would do is just go to those offices, meet with people in those offices, and find out what was going on. What is going on? What positive things are going on, and what's going on that you think might rise to the level of a crisis in the next 6 months? Some of the positive stories could be about a social worker who's gone above and beyond, a medically fragile child who's overcome obstacles to succeed, a family that's helped nurture a child in a special way. And I found that, especially in LA County, that TV reporters love those stories. And it began slowly to create some goodwill. And we also featured those stories, the positive stories, on the homepage of our external website. And lastly, what I did was keep staff informed. As you probably know, morale in a child welfare agency can dip pretty low. So giving staff as much information as you can helps them to feel more empowered, and therefore helps to raise morale. Finally, for directors of child welfare agencies, I can't stress enough the importance of including your PIO in the policy planning of your agency and all of the policy outcomes and goals discussions in your agency. It's really vital. I think a lot of times communications people are an afterthought, and people run to them when there's a crisis. But I think using them and using their knowledge and their talent in the policy planning phase is really important. And your PIO can help you map out an effective strategy to inform the staff and also help you identify any of those potential media crises. So that's it.
Thanks. So we've really been kind of focused on the time of crisis, and I would just say, going back to the initial themes, that as an organization, we're still kind of managing the crisis. We haven't yet gotten to the point of performing. We haven't moved to the point of gaining the confidence of the public. And so it was really critical to begin to say, how are we going to define the reality of child welfare in Los Angeles County? We decided that we were doing way too much, can't communicate this to the public, it wasn't going to get us out of the crisis. So we decided to focus on 3 goals. And that was going to drive the work as the agency. And I would just say, if any of you are thinking about crisis communication and you can't say the 3 priorities of your agency, you're going to struggle during a crisis. Because if the question is, well, what are you trying to accomplish? Or a question more importantly to a worker is, so what's important to your agency? And they say everything. You've lost the battle then. And so we decided we're going to focus on 3 goals. They were to reduce reliance on out-of-home care, to improve safety for children, and shorten timeline to permanency. And really said they were responsive to the public values and public goals. We could measure all of them. We would do that publicly. And we could talk to people in a way that suggested we actually cared about kids, that we weren't counting beans, that we actually were concerned about how children in our care were doing, and that we could make things better, and that we were going to do something about what had happened historically. So we identified those 3 goals, which began to put a foundation to the work that we needed to do to manage the crisis. We consistently communicated those 3 goals across every setting that we could possibly be in, with the board, with the media, with staff. The media knew what we were focused on and what our priorities were. And we were very clear that there were things that we weren't going to do very well because we hadn't focused on these fundamental areas yet, but that this is going to be our focus. And so if there was an issue on education, We need help in education. Our focus is on improving safety for children, reducing reliance on out-of-home care, and shortening time to permanency. And so the establishment of those three goals was one of the critical first steps. We also had to make decisions consistent with those three goals. So it's great for this guy from Minneapolis to come in and start talking about three goals, but when it comes down to making decisions, are you going to make decisions consistent with those goals? Because workers are out there watching, the public is out there watching. And so, as I mentioned, the redeployment made a huge difference, really saying that we were going to make difficult decisions. But a second decision that we made was that we looked at, okay, if we're going to improve safety, if we're going to shorten time to permanency, reduce reliance on out-of-home care, where are the challenges for us geographically within the county? Well, they were in South Los Angeles, in Compton, in Watts, and at the time, Louise mentioned we had 17 offices. A guess as to how many offices were in Compton or Watts? About 0. And that's where all of the children were coming from, a large percentage of the children. That's where a lot of the issues were. And so we said, we're going to open an office in Compton. And rather than just open a facility, which would have been a more bureaucratic approach, we decided to actually approach it differently and had meetings with the community, really ask people what they want from DCFS if we're going to be in your community, and we're going to relate very differently to the community. So we established those three goals, communicated every place, but also decided that decisions really needed to be consistent with those goals. The second piece was that we decided, okay, we have three goals. How many of you feel like your agencies are engaged in too many different initiatives? Because that was clearly the case in Los Angeles. So what we said was, okay, we have these three goals. We're going to focus on 5 strategies, and that's going to be the universe of what we focus on, is these 5 strategies, and each one of them is going to be tied to a specific goal. A very simple message to give to the public, and a way that we believe to focus our resources in decision making. So we decided that we needed to redesign the front end of our system, so we did something called point of engagement. We needed to redesign the back end of our system, talked about concurrent planning redesign, and then we did a permanency partnership that really focused on those 19,000 children who had been in long-term foster care, and there were some things that we needed to do. All of those were strategies designed to shorten the time to permanency, one of our 3 goals. Second, and Louise touched on it, we implemented structured decision-making, saying that we need to have better decision-making to improve safety for children. So our goal related to safety, we had a specific strategy for that. And then finally, we implemented team decision-making, saying that could impact time to permanency. So we were very clear. 3 goals, we have 5 strategies that are intended to impact those goals. So when we talked to the media, there weren't loose ends in the message. It was, this is what we're about, these are our priorities, and this is what we're doing to improve things. And we had to make decisions that were consistent with those goals. And what it did for us was, to me, give us a story to tell, that we were really about improving outcomes for children and families. That was our focus. We knew what we were doing. We had strategies in place that would improve those outcomes for children and families. This wasn't guesswork. We weren't incompetent. Our workers knew what they were doing, and we would. We would be transparent. And as Louise mentioned, we implemented several strategies, even within the constraints of confidentiality in California. We still said we can share information about cases if the court gives us permission to do that, and we will seek that permission. We will set the direction. That the direction is not going to be set by everybody out there, all of the advocates, that we'll set the direction as an agency, and that direction will be responsive to the public. And that the Board of Supervisors, the LA Times, the union, everybody else who had been setting the commission, was not going to set the direction for the agency, that we would be accountable and that we would measure our performance and we would be the ones who would get us out of the mess that we were in. So this is kind of a beginning change that we saw in some of the media coverage. And as you can see, the tone is a little different than foster care holocaust or the most dangerous system in the country. And I think it was reflective of the strategies that Louise talked about and what we began to articulate as we were looking to try and improve our performance. Just a couple of more concrete tips, because I think the goals and the strategies really critical that everybody can kind of understand them, but some practical tips that I also think help to begin to change how we were perceived as an agency and the management of the crisis. One, I think that we spent a lot of time looking at who's quoted in the media as criticizing the agency. And we actually decided to reach out to them and meet with them on a regular basis. And so we structured a meeting of a variety of advocates who were always in the paper talking about the agency. And we said, we're here to work with you to actually correct some of these issues rather than wait for you to criticize us in the paper. Because if, and Louise as a former reporter knows this, that the reporters are going to go to people who will give them good quotes about your agency. And if you aren't working with those people, you can expect that they will give very good quotes about your agency. The second thing that we did was using data. And in California, we're very fortunate to have Berkeley. So we could say, we aren't producing these numbers. These are numbers that are produced by an outside entity. And when you look at safety, you can measure safety. You don't have to wait for a child fatality, LA Times, to measure safety. You can look at recurrence of maltreatment, and it's a safety measure that's publicly produced. We will talk about our progress in improving safety for children in the context that we believe is most accurate. Child fatality is great for you to cover LA Times. We know you're going to do it. But you really need to know what's happening with recurrence of maltreatment, because that'll give you a better sense of safety. Or you really need to know what the timelines to permanency are, and you can look at the Berkeley site and have some idea of that. So using data and really creating the reality for the public was critical. Staff talk to the media. And so if we don't have a consistent internal message, then we're out saying something, are they going to believe me? Or are they going to believe their sister who happens to work for the agency and that they get information from about cases or about what the agency's doing? So it really is critical to perform as an agency and to make sure your internal message is consistent. And I would say the last thing is that we didn't go into this assuming that there would be positive stories. Assume the media is going to play their watchdog role. There were still brutal stories about child fatalities, but it was in a very different context. It wasn't in the context of a failing, beleaguered agency. It was in the context of, this is a bad thing that happened, government is responsible for this, we're going to cover it, but we're not going to also talk about how you're failing as an agency as part of the story. And so really remembering that you're going to get hammered no matter what, because there will be crises. But the message to the public is an important message, and if that message is, this agency's incompetent, here's another example of their incompetence, versus bad things happen, it's a very different message and gives the public a very different sense of confidence in your agency. I'm going to ask Louise just to spend a couple of minutes on the kind of how this was reinforced. Then I'm going to come back and just talk about our actual performance, and we'll close and open for questions.
None of this change in the tone with the public and with the media happened overnight. And I think it's important for directors and public information officers to understand that, especially in the work that you do, that this change is not going to happen overnight. It takes sometimes months and years to set a lot of that groundwork. In between dealing with your everyday crisis-to-crisis situation. But for several months after Dr. Sanders was hired, we did see, as he explained, the headlines, the tone beginning to change, the headlines beginning to change, our relationships with reporters were beginning to change. They did not see us as much as an adversary anymore. They were more open to hearing our side of the story. And a lot of our communications planning we were very lucky with, because we had a great director and a great executive team that set very clear goals. So they set 3 goals for the agency and 5 strategies. And what we did is we just basically used those 3 goals and 5 strategies as our talking points in one shape or form or another. We just piggybacked off of that. So we were very fortunate to have those very clearly outlined in our agency. So those goals and missions themselves served as the talking points that we used constantly. We pitched stories about permanency, the importance of finding children permanent, safe, and stable homes. We found families that illustrated that point. We created events that illustrated that point. We found events in the offices that illustrated that point. And this also went back to the goal of shortening the timelines to permanency. As I mentioned earlier, we explained the strategic decision-making computer tool. This was part of the improving child safety goal. And we stressed its importance to the media, but also stressed its importance to staff, because we found that a lot of staff were confused about the tool. They didn't really understand how it worked, what it was about, how it was going to be beneficial. So we did this through messages from the director and also through an internal newsletter that we had and through our intranet site. We brought in expert staff in different areas to have one-on-one meetings with reporters and kind of walk them through the system. We found that reporters all had different levels of knowledge. Some of them knew a lot about child welfare. They had been covering the beat for a long time. And then there were other reporters who came in who knew absolutely nothing. All they knew was foster care. That's all they understood about child welfare. So we had to explain in depth a lot more about what our goals were, and what we were currently doing in the agency. We utilized ride-alongs for this. What we would do is go to the court, get them to grant us permission, basically, to do ride-alongs with social workers, find social workers that were willing to do that, which was not an easy task either. And that actually was a great tool in educating the media, educating reporters. They became much more sympathetic towards the social workers about the work that they were doing every day. They understood the families better. They understood the difficult situations the social workers and the families and the courts and the agency were put in. So that was a really useful tool. We provided constant updates on our efforts to safely reduce the number of children in foster care, and Dr. Sanders touched on the data. And this is really important. Dr. Sanders was really good about this one fact, that we celebrated our success. And I think too many times in child welfare agencies, you get mired by all the negativity and the bad things going on. But every time we would hit a milestone, reducing the number of children in foster care or finding a certain amount of homes for children, increasing permanency, we would celebrate it as an agency. He would give a message to staff about it. There was a huge managers meeting where all of the managers were congratulated. And I know that kind of sounds hokey and very obvious, but it went a long way in creating morale. And I think that child welfare agencies need to celebrate their success a lot more than they do. So all of that internal, external education, celebrating success, all of that, it began to pay off just slowly over years. We began to see more feature stories about amazing adoptive families. We also saw more in-depth stories about the challenges confronted by the agency, about how difficult the work is in child welfare, how difficult the work of a social worker is, the day-to-day grind and the day-to-day work of a social worker. We started seeing more day-in-the-life stories about that. More editorials about the goals established by the department. Like he said, they weren't always super positive, but they were outlining that, yes, we have goals, we're moving in this certain direction. When a negative article was written, it was more balanced. And as a result, the staff morale began to shift and began to improve. And Dr. Sanders also mentioned that the management team was really effective in reaching out to the community. And we tried to create this goodwill and play off of that goodwill. So for example, he talked about the Compton office that was established. So when the Compton office opened, we did a pretty big media push opening the office. So we had an event opening the office, and it was a headline, something to the effect of, this office is going to affect the lives of like 60,000 children. Well, in the South LA area, yes, 60,000 children, but it got a lot of attention. And we had a lot of reporters showing up based on that it was going to affect the lives of a lot of children in that community. So we were able to generate a lot of buzz in the community, many positive stories. We did tours of the building, tours of the operation, had staff members talk to the reporters, had Dr. Sanders talk to the reporters, all while still enforcing the 3 goals and the 5 strategies. When we worked with law enforcement as part of a gang and drug raid, which was quite often, the role of DCFS and our agency was highlighted by the media. In the past, what had happened was, they would highlight the hero police officers that would go in, and the social workers were always there, but they were never really talked about. When there were children present in the house, who goes in and gets those kids and brings them to safety? But by working with law enforcement, working with the gang and drug liaison in our office, who was a social worker, we were able to create a lot of those positive stories about our role in child safety.
So let me just close on the last point, because I think that we've talked a lot about kind of getting through a crisis, what it takes to manage through the crisis, but ultimately what mattered the most was what happened with kids and families, because that's really the story that is a field we have to tell. And it's important to kind of link those. You don't get out of crisis, and I think it was Patty Jo's comment about you can't make this up. I mean, you've got to get out by performance, and they really are linked. So we were able to reduce the median days in care by over 600 days, significantly reduce the number of children in out-of-home care, reduce the number of youth in congregate care, improve safety as measured by recurrence of maltreatment, and really all of the other measures of safety, including abuse rate in foster care. We were able to get the 4E waiver. The department was increasingly touted as helping children, as Louise mentioned, and I think that we generated community support. And so it really is about linking the performance of the agency, communication, and a focus that's necessary, at least we found was necessary in Los Angeles. So I would just close by saying, I mean, there isn't a secret to this. We set goals that reflected the public expectations. We communicated those goals every place, whether people wanted to hear them or not. This is what we're about as an agency. We defined success. And we didn't wait for the newspaper to define success or failure by saying, look what's happened in this agency, but we defined success by saying, these are the things we're focused on, we're going to improve on these things, and this is what it'll look like. It was most important for us to define success not as the presence or absence of crises, but really what our work was about, and it was important to do that. Ultimately, we believed we had a story to tell, and we're really proud to tell that story every place that we went. And I think that you can tell how proud your agency is by whether your workers are proud to sit next to somebody on a plane and say, I'm a child protection worker in this county and this is what I do for kids. Because I think that's the message that's the most important and that people are going to have to be able to give. And I know that I have heard anecdotally that there have been times in Los Angeles where that wasn't the case, where workers were not proud to talk about what they did. It really is critical for the agency to perform so that people take pride in the work that we do. And Louise was key to that. All of you have a story to tell. You're really either saving families, strengthening families, saving children. It's a very compelling story. So go out and tell that story with pride. Thank you very much.